Well, hi Tom, how are you doing?
I'm good, Adam. Nice to meet you.
Yeah, nice to meet you too. Thanks for coming on today.
No problem.
Perfect. For those who don't know, Tom, you're a sports physio, is that right?
Yeah, that's right. I'm a physio, work in sport, work with people who've had big orthopedic traumas and also people who have sports injuries just in general population.
Perfect. So just bring us back to your start. How did you get into that field?
I was originally a physio in the NHS, so I did some low grade band 5 MSK roles, and then I transitioned to doing some community work. And then I've always loved sport, so I wanted to do a little bit of sport. I basically started off getting a job in private practice, and that led to me having a bit more time on the weekends. So I then started getting into some sports and building my way up from there.
Okay, brill. So the topic of today, really, we're going to look at the difference, or if there's a difference, in your opinion, to sports physio compared to normal physio. So
Okay.
yeah, so I'll hand it over to you. To you personally, what do you feel is the difference?
So I think fundamentally there's different expectations by the patient or the team or anybody around that athlete versus in general population. There are some overlap in certain situations, but some of the fundamental differences are, let's say you have an athlete who needs to be able to play in 5 days' time, or to know if it's safe for that athlete to return to their sport in 5 days for a big match. Then you
Mhm.
need to make a decision and have a plan in place, or let the coach know, because they need to rule that athlete out. If we have somebody who's injured and they're in a general population, they don't tend to have that kind of time constraint on them. They might have an event coming up, but they can kind of cancel that event or reschedule it. So that allows us the sort of the ability to have time to do their rehab thoroughly. So fundamentally, then you have to make decisions around what do we do with this athlete safely to get them to the court, or is that just not an option?
Real. So that expectation, does that have a knock-on effect to you professionally in terms of stress or anything like that?
Yeah, I mean, obviously, then as soon as you've got an injured athlete and they're not available for selection, or they might not be able to train, the coach is looking at you saying, right, what's the chances? Are they able to get on the court? Are we starting with them? Are they coming on for half a match? What they want to try and push you and ask you all those awkward questions. So it does get
Mm.
a lot of pressure because you instantly got to come up with answers.
Right. And are you focusing in a particular sport or is it more general?
So whatever the sport is, if you know what the sport demands are, you need to
Hmm.
know what the positional demands are of your athlete, and then you need to know what some of the basic capacity and markers are that you're happy for that athlete. I've worked in lacrosse, netball, I've worked with sprinters and athletes in athletics, and then in general population, I've worked with footballers, rugby players, touch rugby, again, weightlifters, all this stuff. So you've got to know what your sports are, and then you've got to know your athletes and where you're trying to get them to do what where you're trying to get them to. So what it means is if you know the sport and you know what they need to be able to do, then you can start to do your assessment with an athlete so you can
Hmm.
lay out what markers they need to be able to hit. If they can safely do that, then you can move on to the next stage of the rehab.
Hmm.
And this is kind of where we get a bit of overlap, because that's what therapists should be doing with general populations when they get them in for rehab. Okay.
Hmm.
It might just mean that the sports field or wherever you're working has got a more compressed demand on what you need to work out. And you're probably working with them a little bit closer. So you've got more contact time. And then with our general populations, we do this over, multiple sessions or a few weeks. But there should be stages of the rehab that you lay down markers for people to hit, which when they pass those markers, then you get them onto the next stage of rehab.
Right. So in terms of what you're saying, would you say then sports physio is a bit more structured than normal?
It's probably a little bit more intensified and compressed. So basically, you have to know, all right, what kind of injury we're dealing with, what's the expected normal time frame, is there anything I can do to get that better quicker. And if there's not, and it's too much risk, then you discuss it with the athlete. And then you also need to know, right, what's the athlete need to do to be able to get back to training and then to competing and winning. And then you need to set them goals to hit that. If they pass those goals and there's not that reaction in the injury, whatever the injury is, then you feel more confident and you're more happy that they can get through a certain amount of training or a certain phase of the game.
I understand. So we again, obviously looking at the difference, would you say there's a difference in focus within the session? So say within normal physio, you might be looking at that more engagement, for example. Obviously, that focus might change patient to patient, but would you say there is a particular focus within sports physio, or is that kind of too hard to answer?
I think your focus shifts as your rehab shifts, and that's the same with anybody. There'll be certain goals for certain parts of the rehab. So let's say two people come to me with the same injury and it's a fairly big injury. Let's say it's like an ACL, then an ACL repair in Joe Public versus an athlete, the early stages of that rehab are going to be the same. You know, you got to get that knee settled down,
Mm,
work on their range of motion, get their quads firing, and then get them doing other things around their knee to keep them entertained and keep them strong elsewhere. The shift and the focus changes as you go through the other stages. So as you start to get back to ACL, the back end of an ACL rehab, your athletes are going to have higher expectations that you've got to set for them. So you've got to set higher parameters in your sort of markers before you sign them off to say, right, you can start running, or right, you can start doing
mm,
team training. And then you need to probably impart better restrictions on their training, but you wouldn't get them back into training until you've done more drills with them. And I think whether they're an athlete or they're a Joe Public, I think the bit where physio sometimes doesn't do itself justice is doing the rehab with drills on the pitch or on the court. You know,
mm.
we've got to put people through a realistic training environment before they're released into the training environment with their team.
Yeah, understand. Okay, so with the exercise that you give your patients, and now obviously now looking back at your previous experience within the NHS as well, would you say is a greater focus on in terms of observing your patients through their exercise prescription, or is it the same sort of case in terms of here's the exercises and go off and then you see them in the next session? Is there a greater focus on ensuring the right technique, the right amount of reps, sets, and those sort of things?
Yes, so essentially when we see people privately versus NHS, I would say, I mean, I was in the NHS 17 years ago, 16 years ago, so it's quite a while, but the emphasis is different and the expectation's different. Privately, you would spend time in your sessions and allocate more time to do rehab with clients in the gym. That's how
Mm,
we run our practice and how I run my business and how I do my rehab. I would go through the whole routine, reps, sets, recovery, rest in between, and then just checking in and seeing how they're feeling when they're doing stuff. And then from there, if there's anything that comes up as being painful, then we can explore ways around it or alternatives. And ultimately, you would send the plan based on what you find from that session. You would
Brill.
then also kind of set the next things in your plan of your notes so you know what you want to work on next session if they are in a good place. I think my experiences in seeing some NHS clients that come across the private is they're not afforded that time to be able to do that. And that's more a current limitation of the NHS than it is the therapists themselves.
Yeah, I understand. It's something that's definitely spoke about a lot within studying as well. As obviously, I'm a student now, and yeah, it is mentioned about what to do in that time. In that light, in terms of that reduced amount of time for physios that are maybe have a sports injury within an NHS setting or just in a setting with a reduced time, is there something you would say to focus on specifically with that patient?
It's hard. I think if they need to do strength work, then you need to focus on strength work. If they need to work on their range of motion, they need to work on their range of motion. I think in the short space of time you have, I would mainly pick 3 or 4 things that are really effective for this person and spend the time showing them those and how to do them properly. It'll give them more confidence, it'll make them feel like they understand better what they're doing, and they're ultimately put more likely to do it. If we just hand over sheets of paper and then don't do anything in relation to demonstrating exercise or giving them little pointers on to make that feel
Mm.
comfortable, or checking if they've got pain when they do it, they're not going to do it.
Mm. Definitely, and maybe in making the exercise relevant to them as well. So I'm assuming within your field, the exercises prescription is very tailored around the sport itself.
Yeah.
Is that something that you developed during your time as a sports physio, or is that did you kind of go in with those skills already, knowing, okay, for a lacrosse player, for example, these are the key exercises that we should be focusing on?
I think I probably picked it up from other people who work in those sports. I was new to lacrosse when I went. I never had played the sport, so I didn't know the demands of it. But spending time with other, whether it's the S&C coach, it's the coach themselves, it's the manager of the teams, watching the sport, I would watch video that players have uploaded or team managers have uploaded. I'd understand how the players have to move and what their demands are, and then I'd cross correlate that with some research and data, and then I'd speak to people on the sideline who are organised or been in the organisation for a longer time, and that just gives you the insight then of what you need and what players need, and then there'll be some specific positional needs for, let's say, lacrosse, whether it's a defender versus a midfielder versus an attacker.
Right, okay. And so then you're taking that and you're going to your colleagues and stuff and cross-referencing as well with them.
Yeah, and checking what they think. They'll have, if you look at an S&C plan of players within a team sport, they'll be slightly different based on position. They'll be broadly the same, but there'll be some positional specifics in there that'll mean they'll change what they have to do. So, for example, a goalkeeper in lacrosse doesn't have to go backwards and forwards a lot, but they have to go sideways.
Hmm.
So there's that one example versus an attacking player has to be able to get quick straight line runs or cutting and changing direction. So yeah, you can use that insight and then know what they need to be able to do, both for exercise prescription, creating drills when you're in the end stage of the rehab, and then sort of blending them back into team training.
Right. Okay, so moving away from more clinically, would you say there's a difference in terms of work environment? So you're working in a private clinic, is that right?
Yeah,
Okay, so would you say in terms of a sports private clinic to a usual private clinic, is there any differences there?
I think we specialize in sports injuries. We have everything that a normal private clinic would have, but we probably then need access to other things like pitches and getting outside, so either AstroTurf,
Hmm.
pitches nearby. Um, and then we also probably need to do, or we would spend more time doing testing with clients when they're returning to their sports, so they know that they're safe. So whether that's strength and power testing, capacity testing, whether it's return to run programs, as well as drills, and then building them back into their training environment.
Okay, so does that involve like away days, if you like, in terms of leaving the clinic and going with them to
Well,
various
most
locations?
most of our clinics will be based close to a pitch or an
Hmm.
astro. So you might end up doing sessions outside on grass or astro with a client. You allocate
Hmm.
the time, plan out your session, get them doing drills that are appropriate to their sport and what you need them to do and their injury. And then other times we have access in some of our facilities to like indoor big studios. So you can
Hmm.
do some stuff indoors with just cones and movement and external cueing, both verbally and with people. So, for example, if I wanted to get somebody changing direction, I can give them a predictable, non competitive action. I can
Hmm.
say, go to that cone, turn to the right, your next cone's over there, move through it, and then we can build the intensity. And then what we could do is get them to do something that's a bit more unpredictable, non-competitive. So they could move and have to dodge around something that's going to be shouted at them. So if they're coming towards me, I could say to them, you go into my right. Okay, so it's unpredictable, but it's not got competition. Then we could do predictable competitive. So that's a really good way. Again, this is another, you could do the same drill, predictable competitive. They're going to race somebody or have to beat their own time. And that might be me. If it's me and them working, I might set a time. I might have to show them what I can do. And then we might have a little competition. And then there's unpredictable competitive. So we might then say, if we want them to work on cutting, you're going to run towards me. I'm going to have a Swiss ball, like a big Swiss ball, and I'm going to wallop you with the ball. And you've got to get around me. So he starts to add a little bit of competition, gets them thinking about what happens in their position. And let's say they're a cross player that needs to get past the defender. I can assure you that defender does not want that player to go past them. So
Mhm.
I have a recent example where I've had a New Zealand lacrosse athlete coming back from an ACL and meniscus injury. And then I've been on a pitch with her doing drills for quite a few sessions with a stick, and I'm just whacking her in the hips off, trying to hold her off, because that's what defenders do to attackers. So
Mm.
you got to be able to be comfortable doing those things. It takes time to build up to it, both for the athlete, the injury, particularly big injuries, and then just getting used to doing it. And I really take guidance from those things from the athlete and the experts. So getting feedback from them saying, all right, is that strong enough? Or if they're saying like, no, you probably need to be a bit harder with me, or no, I need to be able to cut more, or no, it doesn't feel like I'm quite being able to do what I used to do. And then you take that feedback and try and structure it around cueing them and helping them get better.
Okay, so you provide that like environment of honesty as well, and that feedback.
Yeah.
It's nice.
And that's all right. You kind of have to work with them like that. And that's kind of a big difference to private and sports in particular, because not all private clinics will then do the sports end stage rehab and
Mm.
just cast people into the wild. And I find that astonishing that they just do that.
Yeah. So I've got one last question before we wrap up today. So
Okay.
this is for students who are keen to go into the sports world, or physios that are not in the sports world and thinking about maybe transitioning. What
Yeah.
would you say? This again going to be a hard question.
Okay.
What would you say is a key skill to look to develop before entering that world?
I think communication is really important because you're going to have a lot of people ask you a lot of questions. So get used to summarizing things in short and being able to communicate it to the person in front of you. And what I mean by that is, if it's a coach, they don't want to know what stage of the healing process they're at. You know, they don't care how many stages of bone healing there are. They want to know the synopsis of how long of the player out, what's going on, when will they get back to training, possibly. And then you need to be able to tell them that. And also that communication will change if you have a discussion with a team doc who was wanting to know all those specific details. So you've got to be
Mm.
able to pivot both ways with your communication, explaining technical things to people who are not medical trained, and then
Mm.
being able to have those technical conversations with people who are medically trained.
That's great. It's nice to hear like all those differences between sports rehab and normal rehab, but then that key skill is kind of that overarching skill that kind of that's very relevant in both. So that's great to hear.
Yeah, it's really cool. And I think once you get into a sport you enjoy and you're in a team that is with people around you who are enthusiastic, you know, you'll feel supportive and you'll feel like you'll be able to contribute and open up about those things a lot easier.
Great. Well, I really appreciate your time today, Tom.
No problem.
Perfect. And maybe again we'll get you on the podcast.
Yeah, that'd be cool.
Perfect. Cool. Take care.
Thank you.